HESI A2 Appendicular Skeleton Questions. Question 1. Which option identifies the bone with this feature? It is the largest tarsal bone. Option A, ilium. Option B, cervical vertebra. Option C, false rib. Option D, calcaneus. The correct answer is option D, calcaneus. This bone participates in supporting walking and jumping. It forms the heel and provides leverage for calf muscles, and it is the largest tarsal bone. Those details distinguish the tested concept from related choices. Question 2. A review item describes a bone that creates the main hinge articulation with the humerus. Which option identifies it? Option A, false rib. Option B, ulna. Option C, atlas. Option D, thoracic vertebra. The correct answer is option B, ulna. For supporting elbow stability, this bone forms the medial forearm bone in anatomical position. It can also be recognized because it creates the main hinge articulation with the humerus. The remaining choices have different primary functions or locations. Question 3. Which option identifies the bone best matching this description? It bears weight when a person sits, and it forms the postero-inferior portion of a hip bone. Option A, cervical vertebra. Option B, femur. Option C, ischium. Option D, false rib. The correct answer is option C, ischium. For supporting the pelvic outlet, this bone forms the postero-inferior portion of a hip bone. It can also be recognized because it bears weight when a person sits. The remaining choices have different primary functions or locations. Stressed about your HESI A2? We can take HESI A2 for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. Which option identifies the bone that stabilizes the ankle and provides muscle attachment? Option A, frontal bone. Option B, radius. Option C, fibula. Option D, tarsals. The correct answer is option C, fibula. This bone stabilizes the ankle and provides muscle attachment. It lies lateral to the tibia and bears little body weight. These linked features explain the role in supporting the lower leg. Question 5. Which option identifies the bone most important for completing the pelvic girdle because it forms the anterior portion of a hip bone? Option A, pubis. Option B, tarsals. Option C, clavicle. Option D, axis. The correct answer is option A, pubis. A key clue is that this bone meets its partner at a fibrocartilaginous joint. It also forms the anterior portion of a hip bone. That combination is central to completing the pelvic girdle. Question 6. Which option identifies the bones with this feature? They number 14 in each hand. Option A, phalanges of the hand. Option B, thoracic vertebra. Option C, frontal bone. Option D, coxal bone. The correct answer is option A, phalanges of the hand. These bones participate in supporting grasp and fine movement. They form the fingers, and they number 14 in each hand. Those details distinguish the tested concept from related choices. Question 7. Which option identifies the bone that forms the skeleton of the upper arm? Option A, atlas. Option B, maxilla. Option C, clavicle. Option D, humerus. The correct answer is option D, humerus. This bone forms the skeleton of the upper arm. It articulates with the scapula, radius, and ulna. These linked features explain the role in supporting upper minus limb movement. Question 8. A review item describes bones that number 14 in each foot. Which option identifies them? Option A, phalanges of the foot. Option B, fibula. Option C, sacrum. Option D, ischium. The correct answer is option A, phalanges of the foot. For supporting balance and push minus off, these bones form the toes. They can also be recognized because they number 14 in each foot. The remaining choices have different primary functions or locations. Are you looking for Get Actual questions? Visit our website pokerexams.com to access GED study guide with actual questions and answers. Scan the QR code or click the link in the description to get GED answer key today. Question 9. Impairment of which bone would most directly prevent the following function? Protects the anterior knee and improves quadriceps leverage? Option A, temporal bone. Option B, humerus. Option C, radius. Option D, patella. The correct answer is option D, patella. A key clue is that this bone is a sesamoid bone embedded in a tendon. It also protects the anterior knee and improves quadriceps leverage. That combination is central to supporting knee extension. Question 10. A review item describes a bone that contains the iliac crest. Which option identifies it? Option A, frontal bone. Option B, carpals. Option C, ilium. Option D, coccyx. The correct answer is option C, ilium. For supporting abdominal and gluteal muscle attachment, this bone forms the broad superior portion of a hip bone. It can also be recognized because it contains the iliac crest. The remaining choices have different primary functions or locations. Question 11. A learner connects the clues, forms the main weight minus bearing bone of the lower leg and lies medially and articulates with the femur and talus. Which option best matches both clues? Option A, tibia. Option B, patella. Option C, true rib. Option D, metacarpals. The correct answer is option A, tibia. The function described is that this bone forms the main weight minus bearing bone of the lower leg. A second identifying feature is that it lies medially and articulates with the femur and talus. Together, the two clues explain the role in supporting standing and walking. Question 12. Which option identifies the bone best matching this description? It forms a major part of the ankle joint, and it receives body weight from the tibia. Option A, coxal bone. Option B, coccyx. Option C, sacrum. Option D, talus. The correct answer is option D, talus. For transmitting force into the foot, this bone receives body weight from the tibia. It can also be recognized because it forms a major part of the ankle joint. The remaining choices have different primary functions or locations. Question 13. A physiology item gives two clues. They form the wrist, and they consist of 8 small bones arranged in 2 rows. Which option identifies the bones? Option A, carpals. Option B, phalanges of the hand. Option C, talus. Option D, zygomatic bone. The correct answer is option A, carpals. The role tested here involves allowing complex hand positioning. These bones form the wrist. They can also be identified because they consist of 8 small bones arranged in 2 rows. Question 14. Which option identifies the bone with this feature? It is the longest and strongest bone in the body. Option A, calcaneus. Option B, femur. Option C, metatarsals. Option D, patella. The correct answer is option B, femur. This bone participates in supporting locomotion. It forms the thigh and transmits weight from hip to knee, and it is the longest and strongest bone in the body. Those details distinguish the tested concept from related choices. Question 15. Which option identifies the bone with this feature? It acts as a strut that holds the shoulder laterally. Option A, tarsals. Option B, pubis. Option C, clavicle. Option D, fibula. The correct answer is option C, clavicle. This bone participates in forming the pectoral girdle. It connects the upper limb to the axial skeleton anteriorly, and it acts as a strut that holds the shoulder laterally. Those details distinguish the tested concept from related choices. Question 16. A review item describes a bone that contains the glenoid cavity, spine, and acromion. Which option identifies it? Option A, lumbar vertebra. Option B, a floating rib. Option C, hyoid bone. Option D, scapula. The correct answer is option D, scapula. For forming the pectoral girdle, this bone provides a broad surface for shoulder muscles and articulates with the humerus. It can also be recognized because it contains the glenoid cavity, spine, and acromion. The remaining choices have different primary functions or locations. Question 17. Which option identifies the bone most directly associated with transferring weight to the lower limb in this function, forms one side of the pelvic girdle? Option A, ilium. Option B, coxal bone. Option C, mandible. Option D, calcaneus. The correct answer is option B, coxal bone. This bone participates in transferring weight to the lower limb. It forms one side of the pelvic girdle, and it develops from fused ilium, ischium, and pubis. Those details distinguish the tested concept from related choices. Question 18. A learner connects the clues, form the framework of the palm and lie between the wrist bones and finger bones. Which option best matches both clues? Option A, maxilla. Option B, metacarpals. Option C, talus. Option D, ethmoid bone. The correct answer is option B, metacarpals. The function described is that these bones form the framework of the palm. A second identifying feature is that they lie between the wrist bones and finger bones. Together, the two clues explain the role in supporting hand function.
Stressed about your NA-CCMA? We can take NA-CCMA for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done.
Question 19. Which option identifies the bones most directly associated with supporting weight transfer to the foot in this function? Form the ankle and proximal foot? Option A, tarsals. Option B, a floating rib. Option C, ethmoid bone. Option D, thoracic vertebra. The correct answer is option A, tarsals. These bones participate in supporting weight transfer to the foot. They form the ankle and proximal foot, and they include the talus and calcaneus among 7 bones. Those details distinguish the tested concept from related choices. Question 20. A learner connects the clues, forms the lateral forearm bone in anatomical position and rotates around the ulna during pronation and supination. Which option best matches both clues? Option A, radius. Option B, clavicle. Option C, tibia. Option D, ilium. The correct answer is option A, radius. The function described is that this bone forms the lateral forearm bone in anatomical position. A second identifying feature is that it rotates around the ulna during pronation and supination. Together, the two clues explain the role in supporting wrist and forearm movement. Question 21. A review item describes bones that lie between the tarsals and toe bones. Which option identifies them? Option A, sacrum. Option B, tibia. Option C, atlas. Option D, metatarsals. The correct answer is option D, metatarsals. For supporting the arches of the foot, these bones form the long framework of the forefoot. They can also be recognized because they lie between the tarsals and toe bones. The remaining choices have different primary functions or locations. Question 22. A review item describes a bone that is the largest tarsal bone. Which option identifies it? Option A, ilium. Option B, calcaneus. Option C, cervical vertebra. Option D, false rib. The correct answer is option B, calcaneus. For supporting walking and jumping, this bone forms the heel and provides leverage for calf muscles. It can also be recognized because it is the largest tarsal bone. The remaining choices have different primary functions or locations. Question 23. Impairment of which bones would most directly prevent the following function? Form the fingers. Option A, thoracic vertebra. Option B, phalanges of the hand. Option C, frontal bone. Option D, coxal bone. The correct answer is option B, phalanges of the hand. A key clue is that these bones number 14 in each hand. They also form the fingers. That combination is central to supporting grasp and fine movement. Question 24. A physiology item gives 2 clues, they form the toes, and they number 14 in each foot. Which option identifies the bones? Option A, fibula. Option B, sacrum. Option C, phalanges of the foot. Option D, ischium. The correct answer is option C, phalanges of the foot. The role tested here involves supporting balance and push-off. These bones form the toes. They can also be identified because they number 14 in each foot. Question 25. Impairment of which bone would most directly prevent the following function? Forms the postero-inferior portion of a hip bone? Option A, cervical vertebra. Option B, femur. Option C, ischium. Option D, false rib. The correct answer is option C, ischium. A key clue is that this bone bears weight when a person sits. It also forms the postero-inferior portion of a hip bone. That combination is central to supporting the pelvic outlet.